Welcome to today's HealthLine webinar from the American Association of Kidney Patients, titled Empowering Hope, Shining a Light on Rare Kidney Disease. Thank you for joining us today. My name is Jerome Bailey, and I am AAKP's Director of Patient Engagement and Advocacy. Today's HealthLine webinar event is a special collaboration with our longtime allies at the Rare Kidney Disease Foundation, as we recognize National Rare Disease Day. AAKP services kidney patients across the disease spectrum with various causes of kidney disease, but in partnership with the Rare Kidney Disease Foundation, AAKP aims to increase awareness of rare and genetic causes of kidney disease. As science advances and research increases, we are starting to realize that rare diseases may not be so rare. AAKP's good friend and founder of the Rare Kidney Disease Foundation is Mr. Richard Nelson. He's been a staple on previous AAKP national patient meetings and global summits. You can visit our YouTube channel to view some of his previous presentations where he discusses his own family history with a rare genetic gene mutation that has caused kidney failure throughout his family, generation after generation. We are honored to have the Rare Kidney Disease Foundation with us today to speak more to their work and research to help advance the identification of rare kidney disease conditions. Before we begin, I'd like to share that AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of treatment and protection of patient lives. And we work to ensure that patients have a central role in research and guidance that are designed to determine optimal approaches and strategies for providing health care services, assistance programs, along with choice and access to new products and services. We built this center with the latest polling and engagement technologies to ensure that kidney patients can also take a central role in informing the federal, academic, and private sector research shaping the next generation of healthcare services, assistance programs, and innovative new treatments. We encourage you to respond to our flash surveys and other engagement opportunities that you receive via email as a member of AAKP. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host this webinar as a service to our fellow kidney patients, family members and care partners, healthcare professionals, researchers, and policymakers. AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of barriers for patient access to available treatment options. Now, without further ado, let's get started. In the run-up to today's program, AAKP conducted an independent survey to find out key insights from kidney patients on rare kidney diseases. To set the stage for today's presentation, I'd like to share a few of our findings. We asked, when you were originally diagnosed with kidney disease, was the cause of your kidney disease known or provided to you? 45% of respondents said no, they were not provided a cause of their kidney disease diagnosis. In follow-up to that, 28% of respondents still do not know the cause of their kidney disease to this day. We went on to ask, does kidney disease run in your family? 28% of the respondents said yes, and 8% of the respondents did not know. And lastly, we asked if genetic testing had ever been recommended to them or a family member to help identify the cause of their kidney disease. Over 80% of respondents said no. Thank you to all those who responded to our flash survey. Moving on, we have two great speakers today, beginning with Dr. Emily Naasz. Dr. Naasz is an autosomal dominant tubular insufficient kidney disease, or ADTKD patient, and a passionate supporter of patient advocacy and community building. In her role as program lead at the Rare Kidney Disease Foundation, Dr. Naasz works to create tools and resources to help fellow ADTKD patients spread awareness and advocacy. She is passionate to be working with fellow patient communities to help find and advance a cure for the disease that has impacted her family for generations. Professionally, Dr. Naasz is an assistant professor of political science at Texas A&M San Antonio, where she researches and publishes in public health, conflict management, and international security. Dr. Naasz, I will turn the presentation over to you.
Thank you, Jerome. So I am thrilled to be here. I want to thank AAKP for helping organize this webinar. As Jerome said, I'm coming to you today in my capacity as a patient, as well as the lead of programming at the Rare Kidney Disease Foundation. I hope today I can help shed a little bit of light on my own experiences in getting my diagnosis and share a little bit about what the Rare Kidney Disease Foundation is doing to help shine a light on rare kidney disease. With the time I have with you all today, just a quick overview of some of the things that I would like to talk about and mention. So I'd like to give you a little bit of an overview of myself, my experience, my family history, how I got to this diagnosis, a quick overview of ADTKD. I'd like to share a little bit about what the Rare Kidney Disease Foundation is doing right now to help build a patient community and some of the next steps that we're working on to help advance our agenda and help advocate for fellow kidney patients. So a little bit about myself. So I'd venture to guess my story is not terribly different from a lot of your stories. For the longest time, kidney disease has run rampant in my family. I think ever since we arrived here in America, there has been a record of kidney disease. Up until my generation, it was undiagnosed. My grandma was a dialysis patient, passed while I was really young. I have aunts and uncles with, up until now, an undiagnosed kidney disease. It wasn't until, I think, 2017 that I received an ADTKD UMOD diagnosis. So again, I venture to guess, very similar story to yours. Kidney disease has run rampant in my family, but up until the last couple of years, we didn't have an answer to why this deadly disease remained so prevalent in our family. Where I'm at right now is a director of programming here at the Rare Kidney Disease Foundation. As Jerome said, my passion is helping to advocate for patients, helping to spread awareness. I know there is a lot of a disconnect between the science and the research and medical professionals and what that means for us as patients. So my passion, my goal is to help try and spread that information in an easy and accessible way. And I do so because I think there is a real hope. So this has been a devastating disease for my family, and I'd venture to guess a lot of your families. But I'm here today to offer a little bit of a hope that there's hope on the horizon. There's reasons to be hopeful that this kidney disease that has devastated my family will end with me. That this is not something that will continue to plague future generations. So, what is ADTKD? So, understand that I am answering this question from a layperson's perspective. This is a perspective as a patient. So I am not coming at this from a medical professional. I am a PhD, not an MD. But ADTKD broadly represents an umbrella term of inherited genetic kidney diseases. So the specific variety that I've been diagnosed with is UMOD. So this is one of the more common variants of ADTKD, but what makes ADTKD a rare disease and particularly devastating is its ability to go undetected. Happy to answer some of the questions I think that came up related to testing and diagnosis. But part of the reason why this remains such a rare disease and hard to detect is because it is asymptomatic. So I would not have thought to get tested for UMOD disease unless it was put on my radar by another family member. Part of what the RKDF is working to do is to advance knowledge of ADTKD. Sometimes it looks like just making people aware of the fact that genetic kidney diseases, tend to run in families, and that if your family has a history of undiagnosed kidney disease, ADTKD might be the avenue that you should look to next. So I put some information up here. I'd be happy to pass along the research studies and peer-reviewed articles that have been assembled by Wake Forest and Dr. Blyer's team, but that is the really quick basic understanding of what ADTKD is. What I have enjoyed the most about the RKDF, so the Rare Kidney Disease Foundation, is the focus on a patient-led community. So we all come to the RKDF with different stories and backgrounds, but a similar thread connects us all. It's this kidney disease that has been in our family for generations back. It's this lack of direction. It's this fear, this anger, this angst of not knowing what this inherited kidney disease looks like. But the RKDF has been the patient-led advocacy group that has really helped to move the conversation forward, and has, I think, really helped to raise awareness both in families as well as the medical community. So at the Rare Kidney Disease Foundation, we try and organize our activities into these three broad categories. So we seek to advocate effectively. What this advocacy looks like is grassroots advocacy at the very basic patient level. So providing the patient voice in research and policy. So making sure that research studies centered around the patient voice and the patient experience as medical communities and researchers work to create cures and treatments and therapies, making sure that it's grounded in the patient perspective. We also seek to build community. As I said before, one of the things that I've enjoyed the most about the Rare Kidney Disease Foundation is the community that I've found. It's a community of individuals who have a story very similar to mine, who know what it's like to grow up with fathers and mothers and aunts and uncles and sisters and cousins who've been affected by this kidney disease. So being the community, being the support that others might need once they get a kind of a scary diagnosis that it's kidney disease. The foundation also seeks to increase awareness. So again, ADTKD is a rare disease and rare disorder. Not all nephrologists are currently aware of ADTKD, but what we seek to do is to meet medical practitioners in the medical community and nephrologists and general practitioners where they are, and provide them the information and the research and the studies that they need so that they can in turn advocate for their patients. If you are interested in joining us, I would encourage you to reach out, and here in just a second I will share some different ways that you can get involved. But we are a patient-led organization, so we're always looking for volunteers. It doesn't matter what your skill set is, there is something for you to do. So I would encourage you, if you are in this boat, if you are a patient, if you are a family member, reach out to us. We would welcome the opportunity to work with you and find a spot for where you fit in the foundation. There are a multitude of ways that you can get involved. So we would encourage you to reach out and volunteer, share your story. Again, we're a patient-led organization and community. Sharing those stories is one way that we can start to make our voices heard. It's one way that we can add to the growing body of evidence to give to the medical community. So join us. I'd encourage you to reach out. So a few different ways to get in touch with us. So if you go to our website, rarekidney.org/connect, that's one way that you can get involved if you are interested in volunteering with us, if you're interested in getting hooked up, if you're interested in learning more and receiving our newsletter. That's one way to get involved. Otherwise, I would also encourage you to check out our social media groups, which are excellent resources for, again, building community and helping to advocate effectively. That is all I have. So thank you so much for the opportunity to share a little bit more about my experience and what the Rare Kidney Disease Foundation is trying to do for kidney patients.
Dr. Naasz, thank you for that great presentation. Before we move to our next speaker, I have a few questions that viewers submitted when they registered for the webinar that I'm hoping you can address. And the first question is, my doctor and I are currently working to identify the cause of my kidney disease. If it's a rare genetic condition, how long does it usually take to figure that out? What can I do as my own best advocate to help the diagnosis process along?
So I can only answer this as a patient. I can tell you that it is a large variation in time in terms of how long it takes to get that diagnosis. I can tell you all. For me, it was a matter of weeks. I was fortunate enough to kind of have a head start to know that I needed to be tested for ADTKD UMOD. So for me, it was a few weeks. Others I know it's been a few years. Still others I know decades. So I don't think there's any kind of standard answer I could give you for how long it usually takes to get that diagnosis. In the meantime, though, a few different resources or sources I can share, and I'd be happy to pass these along to Jerome to distribute. So Wake Forest is one of our partner organizations. Wake Forest has been responsible for most of the genetic testing that has helped to funnel people to the RKDF. Again, happy to provide their information and the links to their website. Private diagnostic companies I know test for UMOD, which is only helpful, I know, if you suspect like UMOD is one of the disorders that you think you might be positive for. Otherwise, so Washington University School of Medicine has an ADTKD clinic that they've recently established. Again, happy to pass that link on as well to Jerome. I think bottom line, it's knowledge. I can't tell you that there is a magic formula for success. I think it is arming yourself with knowledge, being able to advocate for yourself, knowing that if kidney disease does run in your family and it has been undiagnosed up until this point, a genetic testing might be your best bet. And again, also happy to pass on the resources and studies that I have to Jerome. And I think arming yourself with that information and passing that on to your general practitioner, your nephrologist, is one of the best ways that you can start to advocate for yourself.
Thank you for that. We did have another question, and the question is, does my kidney need to be biopsied in order to know if it's a rare disease?
So I can't speak for rare diseases outside of ADTKD, but I know the current accepted protocol is genetic testing. So genetic testing is usually like a blood test. I think like a cheek swab is what they also do for that. But in fact, kidney biopsies should be avoided. I believe kidney biopsies are often inconclusive for ADTKD. So in short, for ADTKD specifically, no. kidney biopsies are not the recommended diagnostic tool.
And a last question for you that came in to us. Can people with rare kidney disease still be transplanted? And if so, can the rare disease come back after transplant?
Yes, so I can speak, in personal experience working with other members in the foundation who have ADTKD, and they have been transplanted. So personal experience, and then the literature also says that transplant outcomes are comparable with the general transplant population. So yes, ADTKD specifically, can patients with ADTKD can be transplanted. And there seems to be no evidence up until this point that ADTKD recurs after transplantation. So that's all I can speak to in terms of ADTKD patients. But that is what the current literature and studies tell us.
Thank you, Dr. Naasz, for sharing your expertise on rare kidney diseases and the work of the Rare Kidney Disease Foundation. Now let's pass the presentation over to Christine Hernandez. Christine is not only an AAKP board member, but also an AAKP ambassador out of the state of Illinois. Professionally, she has worked for more than a decade as a registered nurse. In 2016, Christine's world was turned upside down when she received a diagnosis of kidney disease. To complicate matters, further investigation from her doctors revealed that the cause of her illness was a genetic condition that could affect any family member at any point in life, with a daunting 50-50 chance of being impacted. Motivated by her own journey, Christine strongly believes that kidney disease research that supports early identification, the proper diagnosis, and advanced treatments are in desperate need of increased funding. She understands the urgency of ensuring that kidney warriors like herself have the necessary rights and legislative support to live fulfilling lives that support their aspirations without unnecessary worry. Christine's unwavering determination stems from her desire to use her extensive nursing background and personal experiences to make a real difference. Christine, thank you for being with us today to respond to a few questions about your personal experience of being diagnosed with a rare and genetic form of kidney disease. So, to start with, please tell us a little bit more about your kidney disease diagnosis.
In 2016, I asked my doctor if I could have an evaluation for kidney disease because both my brothers had kidney disease and kidney failure. I had aunts and uncles that had kidney failure, and my mom had some kidney disease. So when I went for the evaluation with the nephrologist, my first nephrologist, he couldn't find really anything wrong with me besides being a little dehydrated. That's what the labs were showing. But we talked about it, and he asked me if I would be willing to do a biopsy to look at what's actually going on in my kidneys because he couldn't find anything. So the day of the biopsy came, and he came in the recovery room after and says to me, "I don't have pleasant news for you." He told me that I had lost 60% function of my kidneys and that I have a really rare kidney disease that he doesn't know much about, but that he was going to put me in contact with the right people that were researching my condition. I was just so anxious, distraught, that thought about everything, my children, everything went like really fast in my mind. And I basically contacted the doctor, and we went through the process of me getting diagnosed. with the rare kidney disease. And I was actually tested positive for it. It's called MUC1 kidney disease, and it's a really rare disease. It's genetic, and it's an autosomal dominant. So what it means is that anybody in my family has a 50-50 chance of getting the actual disease. If you test negative, then you won't get it. But if you test positive, of course, then it goes on to every family, that starts procreating. After that, not long, it was 2019 was when I started dialysis. So it went by real fast. And it's just been a journey. And like you said, I am a proponent of research and being proactive and finding out what's your kidney numbers, am I at risk, and knowing about different conditions, because kidney disease is a silent killer.
Yeah. Christine, having been diagnosed with MUC1 kidney disease, what do you know about the condition now that you and your family weren't aware of before?
Well, it's aggressive, right? It's really aggressive, and but it's silent. And with the MUC1, your renal arteries, they atrophy, so they like shrink, and then you have little cysts inside the kidneys, that the tubules, that actually cause it to fail, and that's caused because of that MUC1 gene is replicating, and it actually affects the kidneys.
Can you share with us how has this form of kidney disease affected your family and how it led to you and your family becoming involved in a clinical trial led by the Board Institute that is a partner of the Rare Kidney Disease Foundation?
Yes. Okay. So knowing that we have a really rare disease, and going down my family line, seeing how many people had kidney failure, how many people had transplants, how many people were on dialysis, was really, really like, just like, we stepped back and like, this is like really serious. What can we do to prolong our kidney life? How can we help ourselves? So I gave my family a bunch of information on kidney failure, kidney disease, and knowing signs and symptoms, if any, or how to prevent further deterioration of our kidneys. Then when I met the doctor at the institute, I felt it was important, not only for me, but for my family members, to get checked and see how serious this was. And my family members are also thinking, like, for instance, my daughter, she says if she has it, she doesn't want to go forward and have children, because then her children will have a 50-50 chance of getting it, and then it'll go on. So it's affected us, like, emotionally, knowing that we have it, and knowing that it's a pretty aggressive form of kidney disease, and knowing that our lives are going to be changed. And our lives were changed when I got diagnosed.
So, what is it like to be a part of a clinical trial?
I feel like participating in a clinical trial is so important. It's vital, especially to kidney warriors, because there aren't many treatments or options for us. So participating in clinical trials will open doors, and we learn more about our diseases, condition, and possible treatments, which is why I'm participating in the clinical trials, and I'm urging my children to also, because if we have a chance, a glimpse of finding a cure for MUC1 or a treatment, it'll change everybody's life. And then people don't have to think about doom and gloom. They could think about living normal lives. They get a treatment and they could maintain their lives with a healthy diet, exercise, and just being proactive with their appointments. So I think clinical trials are going to make a difference for not only myself, but other kidney warriors out there that might not even know that they might have this specific condition, or that they could make a difference and possibly be treated in advance before your kidneys fail.
Yeah. So, and on a personal level, why do you feel it's important to get involved in organizations like the Rare Kidney Disease Foundation and AAKP?
I feel like a person has to take accountability, and not only for themselves, but for others, and learn, because participating like in the AAKP and the Rare Kidney Disease Foundation, you learn so much information. You meet so many doctors, so many different people that give you information and education and knowledge is power. And people need to want to do that and make a difference for all of us. And it also is a sense of community, because we all have similar situations, and it feels like it's a good thing to have, especially when you're isolated and you have kidney disease. You have people, peers, mentors, so many people, and a good support group. I mean, AAKP has been wonderful for me, and such a awesome support for me. And if I ever have a question, I look it up and I find out. If I make a call, find out the information I'm looking for. So I think people need to get involved, and a lot of people don't know how to get involved. So I give information to a lot of people about the organizations.
Yeah. And finally, what advice would you give another patient recently diagnosed with a rare disease?
I would say research your disease, find out statistics on it, and also any kind of organizations that are researching this disease, so you could be involved and be involved. Go forward, finding out how you could participate in the research, finding out how this disease is going to impact your family, and also knowing what the future holds for you. So it's empowering, and I could recommend it. I recommend research and participating in clinical trials to people, because it's important stuff, and we're going to make the change. There's no one else. We're the patients, and we have to make the change. We have to dedicate ourselves to finding new treatments and resources for us and our families.
Thank you, Christine, for sharing your kidney journey. It's inspiring to hear about your strength and resilience throughout, those challenging times. So thank you.
Thank you. Thank you for having me.
No problem. If anyone watching has any additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. I'd like to close today's webinar with a few slides on additional resources that may be of interest to our viewers. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As a member of AAKP, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change the status quo kidney care. You will receive a digital subscription to a bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. I also invite you to follow us on our blog and social media for all the latest news and announcements. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download for free of charge, including titles such as Coping, Living, and Thriving with Kidney Disease, conversation starters about questions to ask your healthcare team, about choosing the right therapy for you, or changing therapies, as well as nutritional information and much more. You can also order materials by phone. AAKP has a number of exciting events planned, including our 6th Annual Global Summit on Kidney Disease Innovations, hosted in partnership with the George Washington University School of Medicine and Health Sciences, which will take place virtually July 16th and 17th. AAKP's 49th Annual National Patient Meeting will be a hybrid event taking place in September in the beautiful state of Florida. The dates are to be announced. And finally, our 7th Annual Policy Summit is scheduled to take place November 20th at the National Press Club in Washington, D.C. Registration opens soon, so be on the lookout. And finally, you can also visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our 2023 events and programs, as well as our 2024 programs as they occur. Again, thank you, Dr. Emily Naasz and Christine Hernandez, for participating in today's AAKP HealthLine webinar. And a big thank you to all of our allied partners at the Rare Kidney Disease Foundation for your continued support of AAKP's efforts. We appreciate everyone's time and expertise in helping to make this event meaningful and informative. Thank you all for joining us. Have a great day.